Today I want to talk with you about how we can save the NHS. And not just save it, but help it evolve and to make happen what its original founders wanted to happen. The architects of the NHS thought that once the backlog of untreated disease and disability amongst the poor had been detected and treated, then the NHS would turn its attention towards prevention. Now that never really happened, and today prevention looks further and further away. I think we can fix that. I'm going to set out just some ideas, but we haven't got much time, so let's get on with it. Not only was the NHS the biggest single experiment in social services that the world has ever undertaken, but in the eyes of many people, including many scientists, it was a success. I, for one, see the NHS as one of the world's finest examples of social cooperation. It's a shining example of what citizens can do when they decide to cooperate and not to compete. And the NHS which citizens created is resilient. It's been through restructure after restructure, and it survived. And it's not just survived, but it's grown better. Now, it's hard to compare healthcare systems, but when you do, how does our National Health Service fare? Well, actually, very well. This is just one of several recent international comparisons. I'm not saying it's the best one, but it's one. And the NHS did very well on access, on fairness, and on efficiency. It needs to do better on health outcomes, as do lots of other organisations. We can fix that. Even Simon Stephen, President of Global Health at United Healthcare, said, or maybe I'm not sure if he is anymore, but he said at the NHS, the inconvenient truth is that on most indicators, the English NHS is probably better than ever. And since I created this presentation, even more data has been coming out showing just how good the English NHS is compared to other healthcare systems. So the NHS is performing well and not good enough, obviously. All healthcare systems need to continuously improve. But I agree, we need to do more on health outcomes. And that's not just for the NHS, that's for other cooperative enterprises too. But the fact of the matter is, while the NHS has survived, as a body it's become infected. And this infection has been grumbling along for several years. And the name of the infection? PFI. Here's a vector. And PFI is about to claim its first victims. Bits of the NHS, large acute trusts and conglomerates may be about to die off, or certainly are suffering badly as a result of PFI. But just in case this infection doesn't kill off the NHS, there's a bill, as you know, which is going to cut the NHS into pieces, and this will finish off the NHS. A monster has been created, and it's been let out of the lab far too early. In fact, it's probably been let out of the lab illegally before the government was allowed to do. This was never in anyone's manifesto. The people didn't agree to this restructuring, and politicians said they weren't going to do it. They've let it out early because they're so keen to chop up the NHS and hand out the pieces to their mates. Now, we all know you can't kill a monster on your own. You've got to get together with some angry friends. You've got to organise, and you need a plan. Then you need to corner the monster and put the monster to death. And that's what should have happened. We should have buried the bill in an unmarked grave several months ago. But this is no ordinary monster. This is a zombie. It's rotten and unhealthy. It can do, and it promises to do, a tremendous amount of harm. Professional body of scientists after scientists say it's going to do harm. It will harm and damage children. It will harm and damage disadvantage. It will increase inequality. We need to corner this bill, kill it, and we don't have much time. Here's what doctors said to their friends in the House of Lords. And we've got even more evidence this is the case now. The bill will do irreparable harm to the NHS, to individual patients and to society as a whole. It ushers in a significantly heightened degree of commercialisation and marketisation that will fragment care, aggravate risks to patient safety, erode medical ethics and trust, widen health inequalities, geez, this is awful, waste much time on efforts to regulate and manage competition, and undermine the ability of the healthcare system to respond effectively and efficiently to communicable disease outbreaks and public health emergencies. The government claims the reforms have the backing of health professionals. They do not. Neither do they have the support of the public. It is our professional judgment that the Health and Social Care Bill will erode the NHS ethical and cooperative foundations and that will not deliver efficiency, quality, fairness or choice. We therefore request that you reject passage of the Health and Social Care Bill. Well, a polite request, unfortunately. Things were slowed down, nowhere near enough. As public health professionals, we have a duty to promote evidence, effectiveness and equity in health and social care. The bill as it stands is not supported by any such evidence, and it will simply fragment our system. Evidence from other countries suggests that the proposals are more likely to create more inefficiency and greater costs, and more importantly, increase our vulnerability to infectious disease outbreaks and a bigger health divide. This bill is awful. Wicked almost. This letter demonstrates the widespread recognition within the public health community that this bill is bad for the NHS and harmful to the overall health of the population. There is no research evidence that reforms clearly intended to promote commercial competition will improve quality, sorry about that, and safety of care. On the contrary, they are likely to lead to higher administrative costs, greater inequity and an erosion of medical ethics and professionalism. So, slowing down the bill. We have friends, various places that want to slow down the bill. Other villagers are working hard to trap this zombie and kill it. The Lib Dems could have tried a lot harder than they have done, and the people of England will not forget. What should the rest of us do to slow down and kill this zombie? Well, resist. By all means, resist. And I'm sure if things get further, the people of England will be sensible enough to resist, and that all the healthcare professionals in the NHS, or well, not all of them, but many of them will resist. And march. Let's march for an alternative. Here's the problem. What's the alternative? Because I haven't seen it or read about it. And I'd like to make a suggestion. We need to organise and coordinate a nationwide programme of deep questioning, maybe online, maybe in real groups, tapping into the wisdom of millions of healthcare workers, patients and other people. We need to articulate the alternative. Not in a top-down, out of the brain of one person, mad scientist kind of way, but in a truly participative, engaging, democratic, empowering, inclusive process, using innovative methods. And it's not just a listening exercises about concerns about a very, very poor bill, but the world's largest participative inquiry conversation into the future of the world's 7th largest organisation and the world's largest healthcare organisation. Now, there are a number of ways we can do this. For instance, there's a World Cafe approach. We could have thousands of cafe events. People of England ask themselves the following 4 questions, and from this will come a vision. What do we love and what do we want to keep? Because we don't want to keep everything about the NHS, and there's not everything about the NHS we love, but there's lots we love we want to keep. What do we want more of? This is a solution-focused, optimistic approach. What are the great things and experiences and networks and processes and values that we want more of? We imagine also in 2 years' time, we vision 2 years' time when the NHS is better than we could imagine, what will be going on, and we get people to explain and tell us what will be going on when the NHS is better than we could imagine, and then how will we have got there? What are the necessary steps that have delivered this vision. These are the 4Ds of appreciative inquiry perhaps, but there's these conversational approaches. We've got some highly experienced practitioners that would love to roll their sleeves up, get involved for free, giving of their time and effort to coordinate this national listening exercises. Can I share my vision with you? Well, it's not too different from the vision of those who established the NHS, that the people of this country cooperate to improve the health and well-being of everyone. And of course, this is not a new vision, and it's not just mine. Here's what one urban practitioner said before the NHS was established. A real health service must surely concern itself with the way people live, with town and country planning, houses and open spaces, with diet, with playgrounds, gymnasia, baths and halls for active recreation, with workshops, kitchens, gardens and camps, with the education of every child in the care and use of his body, with employment and the restoration to the people of the right and opportunity to do satisfying and creative work. So we've got a choice. The NHS has been good to us. Now she needs our help, and we need to take some responsibility. David Cameron says he wants clinical engagement. Let's give him clinical engagement on an unprecedented scale. David Cameron says he wants an end to top-down planning. Let's give him bottom-up planning like the world has never seen. David Cameron says he wants the people of the country to stand up and fight. Well, he shouldn't have to ask twice. The prize for success in this fight is huge. Britain's established the world's first national health system. I believe we can also be the first nation to evolve the world's first true health system. But the price of failure is immense to ourselves and future generations. What's the alternative? A bill which machetes up the NHS, leading to fragmented, costly, uncoordinated and unfair care. In fact, it wouldn't be a national service, it wouldn't be a health service, and it wouldn't even be a system. So, we must come up with and implement an alternative, a plan B. We need to finish what we started. Few months to save the NHS. Let's work together somehow and create a plan B for a true health system. Thank you.